There we go.
Okay, thank you. As mentioned, our presenter tonight is Dr. David Rehfeld. Dr. Rehfeld earned his PhD in educational psychology at Baylor University, and he is a speech language pathologist and a board certified behavior analyst. Dr. Rehfeld is an assistant professor at Kansas State University and director of the Translational Research and Clinical Education Lab. Dr. Rehfeld is dedicated to advancing the field of communication sciences and disorders through innovative student training and interprofessional collaboration. His work explores simulation-based learning and interventions that bolster language and pre-literacy skills, aiming to improve long-term social and vocational success for children with communication challenges. Dr. Rehfeld, thank you so much for joining us tonight.
Of course. Thank you so much for having me. I'm sorry, I get really excited talking about all of this. So I do typically disclose to students that I get really excited about this and I have a tendency to talk fast. I have a reminder to myself to slow down. But I'm really passionate about this topic because I think it's so important for us to be thinking about early intervention, preventative intervention, but also for those clients or kids that kind of fall through those cracks. What's available to us to support their learning, especially when those individuals have more complex needs. So I really love talking about phonological and phonemic awareness. I love talking about early reading. As they said in my bio, I'm super passionate about communication sciences and disorders. And you'll note that it did say interprofessional collaboration and practice there, meaning we're looking here at our dual certified individuals, our individuals who are behavior analysts, teachers, paraprofessionals, people who are in the parent teacher association or organization, anyone who's trying to work with us as part of a team. We're going to have a lot of, I'm going to say conversation, but it's kind of a monologue. I'm sorry. About who's in the room, who's facilitating these conversations, who is supporting these interventions and this skill acquisition with these populations. And you're going to hear me say a couple of different times tonight, populations or groups, because sometimes we are talking about different individuals, and that's really important for us as we are thinking about these interventions and what they're targeting. I'd be remiss if I didn't talk about how important reading is. And you know, it must be true because Taylor Swift has an American Library Reading Association or Association reading poster. So it must be important. Reading proficiency is really important for us in healthcare and education contexts as we're thinking about overall well-being, as we're thinking about overall quality of life, vocational attainment, academic achievement. I've included a lot of literature here as kind of a reference for this, but it is sort of a prerequisite for this talk to understand that reading itself is an important thing that we should be aiming for. Reading for all clients, all individuals, all people. There's conversation about reading being a fundamental human right, which is now a much bigger conversation that I'm not going to get into tonight. But if we're saying that reading is important, if we're saying that reading is necessary for people to have a high quality of life, for vocational attainment, for academic attainment, for socialization, we're thinking about things like being able to navigate your own healthcare. You get instructions from a doctor about what to do or what not to do, what you can or can't do after a surgery. You think about school. We talk about reading as its own subject, but then past about third grade, you're now expected to use reading as a way to access math problems, right? You think about word problems, you think about science instruction, you think about now we're in middle school and it's like, well, here's your textbook, read it, and now we'll talk about it. That's how you learn about history. That's how you learn all of these different things. All the way through as professionals, we think about, now we're talking about let's read this journal article that's written in a very professional jargon that I very rarely engage in, or this is a new topic for me. How do we get to a place where we can do that? There's all of these prerequisites that have to be stacked before then. And what I kind of focus on here is the reality that many kids don't start school where the school system says they should be starting for any number of different reasons. And we're going to talk about that a bit tonight. But the problem is that if kids are not starting school where we're expecting them to, that means they're missing the prerequisite skills for where schools are starting in intervention or instruction, which then it's like, okay, well, who are our professionals or paraprofessionals in the room that are then trying to help these kids close that gap? before that gap gets so insurmountable or so large that intervention itself does become challenging. On top of that, I'm like, now I'm just spiraling. We'll get there. On top of that, we also know that certain clients, certain people, certain learners, I'm going to use several terms interchangeably tonight, they need explicit instruction by virtue of their circumstances or by virtue of their condition. So we're talking about our kids with dyslexia. We're talking about our kids with language disorders. We're talking about our kids from lower socioeconomic backgrounds. There's many different variables that mean kids might need explicit instruction. But then, as we're going to talk about a bit tonight, we're often working in under-resourced environments, or the environment itself is resourced appropriately, but we can't be all things to this client or this person. There's a lot of different things to work on. So, how do we prioritize? How do we strategize? How do we target appropriate skills? What needs explicit instruction versus what can implicit instruction be sufficient for? So, I do apologize because for several of you in the room, this may be over explaining things, but I want to make sure that this talk is accessible to those who haven't engaged in this literature or haven't engaged in this work before. So, two of the common models that are used to kind of talk about what reading is. So, on the last slide, I'm like, yeah, reading's important. Alan Kami, actually, back in I think it's like 1990, has a really interesting piece, I think, in language, speech, and hearing services in schools about like we need to actually talk about what reading is because the whole point that he makes in that paper is that if you want to have really good numbers, if you want to have like really successful reading, you just need to define reading as being able to decode words. Because we know, spoiler alert for this entire talk, we actually know a lot of different ways to do this really effectively. And it's really within reach to get a 90% mastery criterion. So if we want to just like make it look good, define reading as this and call it a day and just ignore the comprehension side of things. And you can deal with that separately. So I want to be clear, he wasn't saying ignore comprehension. He's saying deal with it separately. Okay. So what we have here is sort of the simple view and the active view. You'll see that the simple view kind of came out in 1986. So it's been a while, but it still holds up pretty well. The simple view basically breaks reading down into you've got your decoding related skills and you've got your language related skills. And there's skill sets. Okay. I talk with my hands a lot, but there's skill sets and they're kind of a lot of different things going on in these sort of umbrellas that then need to be woven together. And that's where you land on skilled reading. That's how we develop skilled reading, where we're able to decode the written text and understand it and then do whatever it is we need to do with it. Okay. It's often talked about as decoding kind of multiplied or combined with language comprehension or listening comprehension. And those two kind of form an outcome that is reading comprehension that gets us into skilled reading. It's often represented using Scarborough's reading rope, which is the graphic on the left. It breaks it down into your word recognition skills. Like we need to recognize words on sight. We need to be able to decode unknown words. We need to be able to manipulate individual sounds, which is where I'm going to get to and really focus on in this talk today. But those are kind of your decoding related skills that there's been a renewed emphasis on in the past few years because we haven't been doing a great job at this as an educational system for a while now. There's been a renewed emphasis on not ignoring that or not leaving that to implicit instruction. The listening side of things, vocabulary, background knowledge, language structure, literacy knowledge, how books work, how texts work, and then verbal reasoning skills. Again, all of those sort of interplay into, okay, and then can you understand what's being said to you, or in this context, what you're reading? Okay, so that's the simple view in a nutshell. The active view was put forward more recently, 2021, saying that yes, those word recognition skills are really important. The listening and the language comprehension skills really, really important. but also acknowledging that there are other variables and other skills that are needed here. What we call our bridging processes, the act of self-regulating, the act of saying, I'm reading this article for a grad school exam tomorrow. I don't really want to be reading it. It is very boring to me. I could literally be doing anything else. I'm going to stay focused here. I'm going to engage here. I'm not reading itself is not done because I get to the last word in the article. Reading is done when my task is done. There's a self-regulation process that goes into that. But also, your bridging process is acknowledging the connection between spoken and written language, that we're trying to facilitate that connection here so that we're decoding words, connecting the written form to the verbal form. We've got to make those connections as well. So, all of that kind of interplays into reading comprehension. This talk is really focused on phonological and more so phonemic awareness. So again, to try and make this as accessible as I can, I want to break these terms down. Phonological awareness is sort of an umbrella term. If you Google it, there's a lot of images of like literally it as an umbrella to say it's a sort of an overarching set of skills. It's also a construct, but it has all of these other things going on underneath it. Phonological awareness is often defined as your ability to be aware of, to process, and manipulate or do something with speech sounds at a variety of different levels. So, phonological awareness actually also includes the reality that right now, my brain and my mouth are coordinating to produce a series of speech sounds in a way that your brain is then processing at a level that you're not likely conscious of, so that your brain actually recognizes words rather than the individual sounds. Okay. So phonological awareness kind of operates at all of these different levels, starting like sentence, word, phrase, syllable, all of this. So I've got that kind of progression there to say, really, as we think about phonological awareness from an intervention perspective, we think about it kind of at the word level. Can they segment sentences into words? Can they then segment those words into syllables? And can they then segment those syllables into sounds? It kind of progresses through that hierarchy. Okay. Phonemic awareness, though, is what we really care about from a literacy perspective, from a reading perspective, and a writing perspective, actually, as well. We're really concerned about the ability to do all of that at the individual sound level. Okay, because that's where we're now making the connections between spoken and written language. Phonemic awareness, there's a article cited here from back in 2012. Like, yes, it's old, but it is held up. Phonemic awareness is a really strong predictor of long-term reading achievement at school entry. So this is where I go back 2 slides and I say, all right, remember when we said though that many kids aren't starting school, quote unquote, where they're supposed to, which is now a problem because if we're saying their skills when they start are a really good predictor of their overall reading achievement, well, now we've got a problem because what we're saying is that these kids who are coming in with weaker skills, well, they're not going to learn how to read as well as they could if they had started early. Now we get into a lot of potential for blaming systems, blaming parents, blaming. We're not going to do that. That's not useful. What we do need to then say is, all right, so if they show up and that's the situation they're in, they come to your clinic, they come to your school, they come to your wherever and they do have these weaker phonemic awareness skills. All right, well, is there anything we can do about it? What can we do about it? And that's kind of the focus of our talk tonight. The good news is, yes, there's a lot we can do about it. The good news is we also have a lot of information about how to do things differently based on the literature so that we can be more intentional in our intervention. The key skills that I want us to draw attention to tonight really are segmenting, blending, identification, and deletion. So being able to break words apart, being able to put them together, being able to identify the first sound or target sounds in a word, and being able to get rid of them, which we're going to talk about why that would be relevant later. But those are kind of the key skills that we focus on, we see in the literature that often are targeted for intervention. Again, at the phonological level, then at the phonemic level. So we've got to kind of think about that hierarchy that I've got a graphic of here for you. I think this is from Schul and Boudreau's work back in a year that I don't remember. But the reality is we come back to the kids at risk of developing a reading disability, which the language there I think is really important in the context of if we're not providing appropriate instruction, there's an argument that we actually create disabilities, right? That kids, if they had received appropriate instruction, could have been fine. But if they're not receiving appropriate instruction, we're actually kind of creating a problem, okay, or an issue rather is a better language to use there. Um, so when kids have reduced exposure, so when they haven't been in print-rich environments, when they haven't received early phonological awareness activities, instruction, whatever you want to call it, all right, cool. Then they're going to need explicit instruction to help close that gap. Even if they're a typical learner, even if they have typical overall functioning, they're now going to need more explicit instruction to help that gap narrow. If there's a genetic risk, so we know that language and literacy disorders are to a degree heritable. If they're at higher risk because of that family history, then we want to be preventative. We want to help make sure that that gap we know is already likely to be more present. How do we facilitate keeping that gap as small as possible or ideally non-existent so that it doesn't get bigger over time as demands and complexity increase as well? Because early intervention is really effective. So I go back to Ellen Connie's paper. I go back to the National Reading Panel's work from the late 90s, early 2000s. Early intervention is really effective. We've known it for a while. We've got some meta-analyses I'm going to talk about tonight that again confirm that this is really effective. But we have to think about the focus of the talk tonight being on how to structure these interventions so that they can be as effective as they can be, not to use the same words twice in the same sentence. We can't just skip steps, which is a common misstep in educational interventions, is we're like, all right, they're in fourth grade. Here's these fourth grade expectations. Like, let's get them doing this fourth grade work. And that's not how phonological awareness, that's not how phonemic awareness works. So I want us to draw attention to this hierarchy. I want us to draw attention and focus on this progression because this is what says, all right, I use the crawl, walk, run analogy a lot as we think about gross motor skills. Crawling kind of helps to build certain muscles, helps to build motor planning, get some of that coordination developed so that we can then stand up, we can then walk, we can then proceed to a jog or a run. We don't just expect toddlers to start running marathons because we recognize that their motor skills aren't developed, they aren't coordinated enough yet for that. You can also then, I'm not a physical therapist, so if forgive me if the analogy breaks down, I'm sure that like being able to move their foot, like if I'm thinking about an infant, like being able to flex and move their, like I'm sure it's relevant. I'm sure it's important. But we don't want to sit here and say, oh man, they're not flexing their foot yet, so don't practice crawling. Again, I'm not a PT, so again, that's not medical advice. Like if the analogy breaks down, it breaks down. But I'm like, if they can do that, great. If we often see kids doing that right before they're ready to crawl, great. But we don't want to then say, sorry, you can't do this. Like, don't start working on crawling. Don't start doing the things we taught. Same concept here, where we want to pay attention to what's diagnostically useful, what's often seen as being relevant, what often is included in the progression, and what can we maybe say, okay, but if they're not doing it, move on anyway. Okay. Rhyming is a really great example of this. Rhyming, you think about nursery rhymes, which I'll immediately blank on because I'm giving a talk on it, right? Humpty Dumpty, right? These rhyming, they're fun. It's supposed to draw kids' attention to the fact that like words sound the same. It draws attention to the way words sound. And it's great because it's developmentally appropriate and it's fun for like infants and toddlers. Please do not, this is not clinical or legal advice, but please do not sit with a 7-year-old and like not let them move forward in phonological and phonemic awareness tasks because they can't rhyme. Because the research shows that you can skip it. It's a developmental, it's a gateway task. If they're not doing it and it's not fun, and in fact, at that age, it's probably aversive, don't waste our time doing that when we can move forward. It's supposed to be a gateway. That's kind of how it functions for us. All right. So we do have several systematic reviews and meta-analyses conducted in the past 5 years, which is wild. You've got Erbley and colleagues a meta-analysis from 2024. Marianne Rice and I both have parallel meta-analyses that both coincidentally came out in 2022. Um, Dr. Rice's meta-analysis really focuses on younger kids. My meta-analysis focuses on kids at risk in general. So we span a wider age, but we only focused on kids who met some diagnostic criteria for having a risk factor. So all of these meta-analyses actually contribute something I get so excited about. I'm so sorry. All of these meta-analyses contribute something slightly different that helps us understand what do we do about this from an intervention perspective. So again, we've actually known since the early 2000s with the National Reading Panel's work, Arian colleagues' work, phonemic awareness, phonological awareness interventions are like generally effective. So again, to spoil the product here, do it. It's effective. We're going to talk about what it is, but like we know that they work. So when in doubt, do it. What we have focused on learning since then is is better understanding the conditions under which it can be more or less effective. So the nice thing here with these syntheses is that we are saying, all right, depending on what we're measuring, what does this look like? What moderates intervention effectiveness? So my meta-analyses, Rice's meta-analyses, Erbely's meta-analyses all kind of look at in different ways. How much does who's doing the intervention matter? Again, talking about resource constraints. If there are things that a behavior analyst needs to be doing, great, then the behavior analyst needs to be doing it. If there are things that teachers are particularly good at, great, then we need them doing that, especially when we're not always all available to do all things for individual clients or people that we're working with. So, not just intervention agent. We're going to talk about some interesting things there in a minute, but also our context for delivery, individual, large group, small group. More interestingly enough, what I'd like to see us doing more in the literature is telehealth, right? Remote instruction. Not getting off into that conversation from 2020, but thinking about, okay, that's a delivery context that as we think about things, how do different variables moderate the effectiveness intervention? That's the practical takeaway for us tonight is these different variables that do or do not influence and how to kind of respond to them. And then a more recent consideration that we triggered with my meta-analysis, but also Erbely and colleagues have also subsequently done a lot with is dosage. So how much instruction do we need in order to have an effect? I love talking about dosage. Doses are great. Okay. To get us into that conversation, again, to try and make this as accessible as possible, I'm sure many of you are familiar with some of this literature. Cohen in 1988 did a kind of review of the social sciences literature and said, all right, how do we know whether an intervention is not just statistically significant, which you can kind of get to with a big enough sample, but really practically or socially significant? What's a meaningful effect look like? Suggested these guidelines of small, medium, and large. The irony here is that in that 1988 paper, in that 1988 work, Cohen also said, do not use these as guidelines. Do not use these as thresholds. Do not do the exact thing we subsequently have been doing for however much, I'm terrible at math, however many years that has been. We now kind of use these guidelines and are like, it's got to be small, medium, or large. And if it's not a 0.2 or greater, it's not worth doing. Literally flying in the face of the spirit of the suggestions themselves. What Cohen said was, here's kind of a starting point for us, but individual fields, individual skills, individual disciplines need to kind of identify in a similar way what this looks like for us. Erbely and colleagues this year have come out with a paper for phonemic awareness, which is just wild to me. Notice again, I get so excited about this. They've kind of pooled and looked at these thresholds from 199 different effect sizes, not 199 studies, 199 effect sizes, and said, okay, for phonemic awareness in particular, focus of this talk. Small effects typically look like this, medium looks like this, large looks like this, which is great. We love that. The fun, the fun part here, though, is if you look at these two kind of data points in connection with each other, medium is like 1/100th of a decimal off from Cohen's suggestion, large 0.08 or zero point 0.8 to a 0.81. Not hugely different. Where we see the big difference here is almost on the small side of things, where a small threshold is really 0.26. Okay. All of this to say, I'm sharing this because I'm about to get into the effect sizes and talk about, again, intervention priorities and target selection. Okay. Thinking about kind of these thresholds for us for small, medium, and large effects, meaning I don't want to use the term that it's worth doing because this is always worth doing, but we want to think about resources that we're pouring into this as we think about hours, as we think about doses, as we think about time, provider, all of these other variables. You don't want to spend $1 billion for an effect that's like, and they can now sound out one word. It's a huge waste of resources. Okay. So, our meta-analysis from 2022, we looked at 138 studies of children defined in different ways as being at risk for weaker reading outcomes. Okay. Overall, we found that studies had an average effect of 0.51, so a medium effect. So again, it works. We know that it works. And we know that it works well, that intervention, when delivered appropriately, works well. Okay. We also broke it down by these other outcomes: segmenting words, blending words, deleting sounds from words, identifying the first sound in words. That's where we see some variability. And now, as we talk about practical takeaways, as we talk about what to do with this, this is where we're like, all right, so we know that it works overall. We see some variability in how well or how much progress, I guess, can be seen on individual skills. We've got to contextualize this again that our meta analysis was focused on kids at risk. So kids who had weaker profiles. Okay. Segmenting, we still see that medium threshold met. Blending, we see a small threshold met. Deletion, if you're going by Cohen's original suggestion, not guideline suggestion, we meet the threshold. If you go back a slide, now looking if Erbely and colleagues' recommendation of 0.26 is what we're going to operate off of, now we don't even see a small effect for sound deletion. Doesn't mean it's not worth doing, which I'm going to get to in a bit, but it does mean, okay, if you're seeing slower progress there, don't be shocked. Right? That's kind of what I want us to take away from here is if a kid's not responding to intervention designed to support segmentation, I'm like, all right, let's problem solve this. Let's figure out what's going on here because in general they do. Remember, our meta-analysis was focused on the kids who are at risk, the kids who are the least responsive in general to instruction. We're still seeing a moderate outcome there. We're still seeing a medium outcome there. So if you're not seeing progress with them, that's where we then say, okay, let's problem solve this. However, we also have to acknowledge that gap that says who's getting included in the literature. So, our kids with really complex communication needs, our kids who have AAC systems, our kids who have a lot of challenging behavior, they're not getting represented in this literature. So, keep that in mind as well. Rice and colleagues' meta-analysis from 2022 confirms again a medium effect, G of a 0.63. Okay, great. So we're not like the effect sizes themselves. I'm like, yeah, 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 it's great. On average, we're seeing an effective intervention here across different profiles. They're focused on young kids. I would argue that's why they see a greater effect size here than we got of 0.51. We spanned the lifespan and focused on kids whose learning trajectories or skill acquisition trajectories are likely a little bit slower in terms of being responsive to intervention. They included typically developing children and said, all right, and those younger kids who often make faster gains because, again, developmental readiness and appropriateness for intervention here. So, really thinking about kind of the differences in these meta analyses and what they tell us about the literature. Again, kind of summarizing that to say it's not that skills don't respond, it's that we do see different rates of responsiveness, and that's expected. And that means it is okay. We want to contextualize our individual work with clients or people who we're working with saying here, all right, we've got that variability. We're going to talk about a couple of key skills here, which is segmenting. And then on the next slide, we're going to talk about blending a bit. Segmenting, we see a big gain in preschool age children from my meta-analysis. We also see some variation here from Rice and colleagues' work in 2022. We see a large effect in preschool children on segmenting. So breaking words into their individual sounds. So I say the word cat and I say, tell me the sounds that are in cat. And the client responds, k, at. That's phonemic segmentation, being able to break that verbal word into those individual sounds. So even in the word word, w, d. We're going to talk about that's complex now because we've actually now got two letters that kind of form that in the middle. This is where we talk about sequencing a little bit later. So we see that segmentation, a really large responsiveness to intervention there. Rice and colleagues, what they're actually seeing in their work in 2022 and then also Herbali's work in 2024 is looking a little bit more at breaking targets or outcomes down into whether they're decoding proximal or decoding distal. So I want to use that rhyming example that I gave earlier. Rhyming is what we would call a decoding distal skill. It's not directly connected to the act of seeing the written word the on the screen and breaking it down into the e, or hearing the sounds the e and saying, all right, that's the. Now I can spell it. Now I can kind of encode it that way. Rice and colleagues, and then Herbally and colleagues subsequently have really focused on that split, that pun not intended, segmentation, to say, think about skills as to whether they're decoding proximal or decoding distal. The more decoding proximal they are, the higher of a value they are to us for intervention, because the whole point of developing these phonemic awareness skills is decoding words to read them and encoding them to write them. So the more proximal you can be to reading and writing, the higher the value of the target. Also, ideally, the more benefit you want to see from your intervention. The more distal a skill is, like rhyming, like even onset rhyme segmentation for sound identification and splitting, the more it's like, okay, we have a little bit maybe more wiggle room here, or the more variability we can be okay with in terms of responsiveness to intervention, because we're really just using those skills to get somewhere else. Okay. So the kind of takeaway from that meta-analysis is going to be the more proximal the skill to decoding, actually sounding words out, or encoding, spelling words out, taking the sound and putting it to a letter, the higher the value, the target, the more we want to be thinking, how are we getting to that if we're not working on it right now? How are we pushing to it, but also how are we allocating our resources effectively? Okay. So segmenting on the last slide, blending on this slide. We see some variability here. Again, I love CSD. I love speech pathology. This isn't like a plug for that. It's to say, in our meta-analysis, we did see a higher effect. Blending itself was our lowest effect overall. But within that subset, when you looked at it by intervention agent, SLPs have a G of a medium effect when the overall group shows an effect of shows a small effect. So this is where I'm saying, all right, let's think about our resources. Let's think about why that might be. Okay. As we're thinking about segmentation, as we're thinking about blending in particular, blending sounds together, blending words together, as we're thinking about our stimuli, our targets, we do get into now, it's easier to blend some words than others as you think about vowels, as you think about liquids, as you think about glides, as you think about the structure of individual sounds. We want to consider that. And SLPs might, by virtue of their training, be more sensitive to how to identify and pick targets in a way that maybe better fosters or supports intervention in that area. That's a hypothesis that I have. Okay. We see strong gains here for kindergarten kids, again, in my meta analysis, as well as Mary Ann Rice's meta analysis. So the idea here is not to then say, well, okay, the overall effect was small, just like with deletion. Just because it has a quote unquote small effect doesn't mean not to target it. In fact, we really want to target blending. We want kids practicing blending skills. Okay. So as we're thinking about, there's a comment in the chat. I do have the chat pulled up. There's a comment in the chat about, again, this is a great opportunity for, doesn't mean the SLP has to be the one to target it. But as we're thinking about repertoires, as we're thinking about stimulus selection, as we're thinking about designing intervention programs, this is where collaborative, interprofessional collaborative practice can be really useful. Leaning on the different resources we have available from members of our team, Um, this is where we want to think about if we have someone who's really struggling to respond to intervention as it's currently designed, this would be my go-to. This is where I would say, all right, let's look at our stimuli. Let's look at our intervention programming. Okay. Because now is where we get to sound deletion, often referred to as elision. Sound deletion also generally shows a small effect. This is one where I would say this is not a priority for me in intervention. It's diagnostically useful. Sound deletion is often included on diagnostic assessments for dyslexia for a couple of different reasons. I'm going to kind of glaze over. But for one being, it taxes verbal working memory. It hits on a weakness that many people with dyslexia often also present with. It kind of hits on a an area that is often weaker in children or people with language disorders. And so sound deletion often is a harder skill for acquisition here. Helps to explain why we see a smaller effect here. It is really useful in the sense of when you think about reading and also spelling. If I can spell or sound out cat, cat, now we then say, okay, take off the k. What word do you have left? Well, now we have the word at. But again, you think about now in the context of working memory, that's a much harder thing. I've got to be able to visualize it. I've got to be able to hold the phonological form. I've got to then take off part of it, but only part of it, and a specified part of it. And now, as we think about spelling, it's like, well, what happens if you put the word or the sound b in there? I hate that um, schwa that's inserted there, but if you put the b in there, now you've got bat. Now you've got a new word that you can spell. And that's where the value comes in. Here is sound deletion to sound substitution, but these are what we often consider advanced phonemic awareness skills. The real priorities for us are segmenting and blending, breaking words into their individual sounds, building words from individual sounds. Those are the key skills for reading and spelling, basic reading and spelling. Okay. So phoneme deletion, I'm like, all right, if we're not seeing progress there, my question is, do we need to be working on this? Are we needing this, or can we move on to other things? Not saying don't teach it, saying how and why are we teaching it? That's best done in the context of those spelling type activities that I was just describing to say, all right, let's spell out the word cat. Now we can have a built-in visual support. Let's erase it. Let's erase that k. Let's erase that C. All right, now let's practice. If we want to add that b in there, if we want to add another sound in there, I try to be very mindful of words and sounds I do substitutions with, especially when things are being recorded, so we don't end up with words that I don't want on the internet forever. Other thing, for sound identification, again, also considered sort of a gateway task. Being able to identify what's the first sound in cat, it's k. Great. Onset rhyme segmentation, we're practicing that individual, that isolation of one sound without trying to isolate every sound in the word. It can be used as a gateway task to facilitate overall segmentation. Okay, to draw attention to that individual form. We often see a lot of this used, but when you think about it from a spelling perspective, it's great for word retrieval. Oh man, there's that word that I'm trying to think of. It starts with a, right, that can be useful. But from a spelling perspective, I'm not often trying to think of how to spell words based on just their first sound. Okay. So that's where we get back to these skills are decoding distal. They serve as a step toward a useful skill. But I'm not generally just hanging out with my friends reading things saying, oh, what happens if I get rid of the M in May? That's not generally what we do here. There's some things in the chat about like word prediction for AAC users. So again, that's where we now think about compensatory strategies, other tools and supports as we're thinking about not just AAC users, but our clients with dyslexia, our clients with other, or our people with other related conditions who may need to benefit from encoding or decoding software techniques. I talk to students all the time. Those softwares, those systems are great if you can get close enough to the word you're going for. That's where these skills become relevant. Okay. We talked about this, so I'm going to move a little bit faster on this slide. Rice and colleagues and Rehfeld, me and colleagues, both found no statistically significant difference between who's doing the intervention, even if it looks like effects are bigger. So we've got options. This is where I come back to who's on our team, what are the resources available. If certain groups are showing better effects in general, great, then I want to lean on them because it shows that maybe there's training, there's something about the way they're approaching this. The irony, not irony, here from Rice and colleagues' work in 2022, they actually go very into computer-based interventions are effective. We see that in my analysis as well, or our analysis rather as well. It was a team effort. They actually lean into, great, so then when are we using resources? If we're saying teachers are understaffed, if we're saying school systems are understaffed, if we're saying healthcare systems are understaffed, then when is it appropriate to use these computer-based interventions? They actually plug in their discussion section and implications for practice. They're actually like, we're recommending software, but it needs to be high quality. That's where we currently struggle is helping people find high quality systems and softwares. But they do give some examples of systems that actually do follow evidence-based or science of reading principles in terms of instruction. So great place to start there and saying if an SLP, if a BCBA, if a teacher, if somebody is not available who has this training, then great. Use computer-based interventions to support their learning. One thing we both saw in both of these meta-analyses as well, though, is individual small group and large group contexts can all be effective at supporting intervention. This is going to then depend on your individual learner's needs. One thing we did actually, weirdly enough, find though, individual is not always better, and large group is not always worse, which is shocking because a lot of parents, a lot of advocates, a lot of well-meaning individuals are like, if it's not individual, it's trash. The research doesn't support that. The research actually shows small group instruction often tends to be the best, even if it's not statistically significant. And it largely comes down to dosage, practice opportunities, the models they're getting. You're actually often, if done well, able to increase input. The goal is then to manage, okay, how many opportunities are we getting to practice and respond? That's where we get into this cumulative intervention and intensity framework. Warren, Fay, and Yoder in 2007, they looked at dose, session duration, intervention duration. How many practice opportunities are you getting with feedback? How often are you getting those practice opportunities? How long are you getting that before you get a break? That's relevant as we think about school systems that operate on semesters or quarters or trimesters. That's intervention duration. How long are you doing this before you get a week off? 2 months off. I'm coming into a summer break. It's not a break for me, but summer break for the kids, summer break for students, right? You've worked for a year, but now you get 2 months off. How does that impact things? If you're in healthcare, thinking about insurance, plans of care, how long do you get before you have to change goals or do a reauthorization? These are the variables you've got to consider as you're thinking about dosage. We and Rice and colleagues found no significant relationship between the dosage overall and outcomes. Herbally and colleagues 2024 actually should look their meta-analysis is focused on cumulative intervention intensity. They found that outcomes overall typically improve until about 10 hours of intervention and then they go down. So they found a parabolic, they found a U-shaped curve. It increases to a point and then goes down. Now we're looking at that resource. We're looking at responsiveness to intervention. We're like, when do we shift? They do make a good point that I will emphasize here that that doesn't mean insurance looking at you cut off at 10 hours of instruction. That doesn't mean teachers say, well, we've done 10 hours, we're done here. What that's saying is that if you're following that typical curve, typically the trade-off becomes there's something else that likely needs to be going on here. And that's where we're looking at phoneme grapheme, letter sound letter rather, correspondences, trying to shift to reading. That there's a point at which just continuing to work on phonemic awareness is no longer the move. That's no longer the instructional choice. It's working more on those basic reading skills. That's the transition point we're likely seeing here. That's what they acknowledge in their paper. Okay. We have to remember, though, that again, often as SLPs, as behavior analysts, as other professionals in the room, we're often working with individual clients with unique learning needs as a virtue of their condition and their circumstances. So, this is where, as you're thinking about plan of cares, as you're thinking about reauthorizations, as you're thinking about rebuttals or denial, I'm blinking on the term. Um, that's where we've got to lean on. You don't get to quote this literature at me and say, sorry, you've already spent 10 hours on this. What's the unique thing that's going on with this client that changes their trajectory? Okay. Herbally and colleague actually kind of define an optimal dosage window for individual intervention. So again, our learners who often have the most complex needs extends to, it's like 16.62 or something, but I'm terrible at math, so I rounded to 17. The idea here being that that individual, this is again, I'm aware this is being recorded. I need the world to hear me say this. This isn't saying do individual because you can get more benefit from, you get an additional 7 hours. It's recognizing here that the people that get individual intervention are often the ones who have the most complex needs, which would help to explain why they see extended benefit. It's not that they're getting more out of it, it's that they're needing that additional time to get that full benefit. This is useful to us as we're thinking about designing intervention, insurance, as we're thinking about IEPs and schedules of services, because again, we're reserving those individual sessions for the kids who need it the most. Okay. So those small group, that large group, as we're thinking about individual profiles, as we're thinking about relative need, it's not about time. Okay. It's about how we're spending that time. It's about the dosage. It's about exactly what you're here for tonight, these practical takeaways. We want to include graphemes when we can, when it's developmentally appropriate. Sorry, I'm loving the positive feedback in the chat. It's really getting me going tonight. I appreciate it. Um, and including those graphemes when it's appropriate. I'm not sitting here with a 2-year-old showing them letters. It's not developmentally appropriate. We're not ready for that. But we come back to decoding proximal and decoding distal skills. The closer we get to the expectation being basic reading skills, the more we need to be including those letters. So we want to be including that to the extent that we can. My meta-analysis in 2022 with our at-risk kids, our kids who are at risk, does show a stronger effect when you include graphemes versus when you don't. This has been a huge debate in the literature in like the early 2000s. Do you include them? Do you not? Right? Is it okay to do it without them? Are you doing a terrible disservice to kids doing it without them? The research shows it works either way. It can be better, can be more effective slash efficient if you pair them together. That adds complications as we think about behavior analysts, as we think about SLPs who don't inherently always get training on developmental ordering of letter instruction. Like what sounds, what letters, when to include them, what's reasonable. Now we get back to that SLP context of thinking about like how sounds change when they're in a cluster, how they change when blends are next to other sounds, how vowels shift. Back in the word it's an O, but it says plot twist. Okay. So we can see a stronger effect there. Herbally and colleagues' work in 2024 actually shows that when you include graphemes, they tend to have a longer an effect that lasts longer. Again, as we're thinking about that skill transfer from the oral language skill of phonological awareness, manipulating sounds, to the written language skill of manipulating letters, we're facilitating potentially that skill transfer here. Okay. They're pointing out that even after 16 hours of intervention, that combined intervention of sounds with letters actually continues showing gain. So it changes that skill trajectory from that just inverted, that parabola, that upside down U. It actually kind of shifts that a little bit to say we actually keep seeing the gains because you're connecting this set of skills with the basic reading skills, the actual doing of the reading. Facilitating that transfer actually keeps targeting phonemic awareness relevant for longer because you're using it in the context in which it's needed, which is the reading and the writing. Okay. Back to those coding and proximal skills, that segmenting and that blending. That's why those skills are key. They facilitate reading and writing. But that's where we then want to say if the point is to get to there, how is what we're doing over here with phonemic awareness actually helping them to do that? Okay. Part of this is also saying, again, I said earlier, under-resourced environments, really thinking about trying to be as efficient as we can. We've often got a lot of things to work on. That's something I talk about with my students all the time. It's very rare that I see a client and I'm like, here's the one thing that you very clearly need to work on, and nothing else is a need at all. Never the situation we're in, especially in preschool, especially with our younger kids. There's often a lot that needs to be supported. We're looking at skills, we're looking at different repertoires. So I'm pivoting just a little bit to reference. I was asked to also talk about a study that I had published this last year, where we also looked at narrative intervention, narrative language. Go back to like slide 3, looking at our strands. We've got our decoding skills and our language skills. Narrative intervention is really important. One thing that's really beneficial to us here is Spencer and Peterson have, this is not product placement. I'm not getting, like, there's no benefit to them. Like, I am referencing a product, but there's no benefit to me in referencing it. It's referenced in the research study. Spencer and Peterson have story champs. They have a manualized intervention for supporting language, narrative language development in children. There's a lot of research on it. Um, but it's what we call a manualized intervention. It's designed to be able to be implemented by literally anybody to acknowledge this resource constraint. So in the study that I did with preschool children, it was in a preschool setting. It was with kids who had a variety of communication disorders, from language disorders to fluency disorder, stuttering, to articulation disorder. We had kind of the whole gamut. Okay. We had 8 preschoolers. They were in 4 dyads, so they were in small groups. So there's that small group context. We used a multiple baseline across participants design with a I love this. We also used a repeated acquisition design, which is just super fun to me. I love them. Megan Kirby is the one who kind of turned me on to that design itself. Repeated acquisition design, essentially pre and post testing before your session, after your session. What's the gain each session? It makes the graph look terrible, but we're going to see it in a minute. Our independent variable was story champs for 15 minutes. So they got 15 minutes of literally just story champs as it's intended to be run. On either side of that, we did 2.5 minutes of phonological, note phonological, not phonemic, phonological awareness, because these were younger kids. Phonological awareness intervention with them as a bookend. We used the vocabulary in the narrative for the day. Whatever narrative was being targeted that day, we pulled the vocabulary. Story Champs literally has the vocabulary in there. This is where I, as an SLP, said, okay, here's the words we're going to target of these options based on developmental appropriateness, complexity. There's your resources again. Okay. But we bookended it. 2.5 minutes. Our grad students implemented this. 2.5 minutes either side. I don't love the term drill and kill, but it was high dosage, narrative intervention, recap the phonological awareness, go about your day. Okay. Our grad students implemented this after BST from me. I've got the protocol in the paper, I believe, but we literally trained them on how to do it. Story Champs is designed to not even need it. All I said was, what's the PA look like? Present the word, model it, give them some blocks, slide the blocks, show them what it looks like, do it repeatedly over and over and over again. It's only 5 words. You're training those 5 targets. Okay, over and over again to get that high dosage. Our primary DV, our primary dependent variable, was a generalized story retell. So we didn't just look at their data in the session. What we did was say, okay, on these preschool storybooks, we're going to read them to you. All right, tell us as much as you can remember. Tell us the story, just like teacher did, or whatever. And we used a rubric that comes from story grammar principles, story macro structure, the key parts of a story. Our secondary DV, which is more relevant to this talk, was pre and post testing on syllable blending. So that's the skill that we targeted in the intervention, but we used a completely unrelated list of, or a randomized list of words, not completely unrelated, but it was randomized to make sure that we weren't just teaching to the test. We weren't just teaching like they're doing terribly this morning. We teach them these words, and then at the end of the day, they do better. Not great research. What we did was then say at the beginning of the day, as they came in, here's your pre-test, here's training on different words. Here's your post-test on the same words you saw this morning, but that are not the words you were taught today. So we practiced the skill, but not the targets. We did this. We collected this data 4 days a week, Monday through Thursday, 8 a.m. and like 11 or 12 p.m. because it was a half-day program. IOA Was over 94%, which is great. Treatment fidelity was 96%, which is also great. Data collection was blind. So I trained grad students on how to collect the data, but they were not privy to the study hypotheses. They were not invested in this project in any way, shape, or form. They were just measuring these skills. It is what it is. Okay. So here's our story retail graph. We saw immediate changes. So this is, I'm going to kind of gloss over this because this is not actually news. All we did with Story Champs generally says do 20 minutes. We did 15. Our narrative outcomes are still good. We see a functional relation in all of our dyads. It's a mess because we have 8 participants, but what we do see is that the behavior changes when and only when the intervention is implemented for each of these dyads, which is great. Okay. What's interesting is the phonological awareness side of things. So this is where I'm like, now the RAD gets interesting because we had to condense it so that we could see the skill gain, not the individual pre-post, because it was just dots all over the place. What we see here is that everybody improved their syllable blending. Only 3 of the 4 dyads showed an immediate effect. So 2 of the dyads, there's a delayed effect. So you don't love that when you look at a functional relation, but we did see 3 out of the 4 do that. But no, I did not freeze. I'm just being reminded of this data. Look at the variability you're seeing in this intervention. That's the challenge. Okay, so if you look at the baseline, the good news is they're stagnant. The bad news is they're stagnant, which means these kids are not making any progress in their ability to blend syllables together. Cow, boy, what word does that make? Cowboy. What we do see is greater gains in the intervention phase. The problem is that you don't love all of that bouncing. You don't love that the gain they're seeing when they walk in the morning from when they leave at the end of the day, that some days they're going up 5 full points. They're blending all the words correctly. The next day they don't make any progress whatsoever. There's a lot of variability here. That's the challenge. That's the consistency. So what our takeaway was from this paper was they only got 5 minutes total a day. That is really low. That is really low. But we were looking at efficiency. We were looking at manualized intervention. We were looking at, is this reasonable when you think about SLP intervention sections or sessions rather are often 30 minutes to an hour. You think about preschool rotations, you think about kids' attention spans. We were trying to stay in that like 15 to 20-minute range without just like gutting story champs. Okay, gutting that existing manualized narrative intervention that has a lot of research supporting it. We wanted to say, what's the wiggle room here? Good news is, cutting to 15 minutes didn't really dilute the quality of the narrative intervention. Bad news is, it wasn't as great as we were hoping for the phonemic awareness. But the other thing to think about here as we're thinking about variables, okay, is these were preschoolers. These are preschoolers who are sometimes walking into this classroom still asleep, and we're doing this pre-testing. They're preschoolers. They have a rough day. They have a rough morning. It was raining. They didn't get to go. There's any number of reasons why post-testing may be variable with them to the beginning. And that's not me trying to be like, and thus our intervention actually did work. It was just measure. It's me saying these are the things we've got to think about as we're designing plans for learners. We've got to also think about how we're measuring success and their outcomes. We've got to think about the validity. That's why I included the IOA and the treatment fidelity from a reliability perspective to say we know that the intervention was implemented with fidelity and we know that it was measured well as well. But just because it was measured well doesn't mean there weren't contextualizing factors here. This is the challenge with working with younger kids. There's inherently potential for dysregulation. There's inherently potential for any number of things to affect measurement. We've got to consider that as well. So what's my key takeaway from this? It's that we do have flexibility in how we can do things. The idea behind the intervention that we didn't publish the intervention, so Story Champs plus our manualized intervention, which is documented in the study. The idea was we wanted something that could be added to an additional program that could be manualized so that you have an SLP pick your targets, but these were graduate students, yes, in training to be SLPs, but they're not qualified SLPs yet. Several of them were in their first or second semester. They haven't taken these more advanced classes yet. So the idea being we could show that it worked and then go to do some of the things that Dr. Spencer has done, which is Let's look at Head Start teachers actually implementing this, people who don't have this specific training. Does it work there too? What I would then say is if you can have an SLP help to pick your targets, what we see here is expected variability by age, but a functional relation in your target. So we show that the intervention works. The goal is then saying, does it work as well as we need it to for individual kids? Okay. I love the RAD design. I love it. It's redundant to say design there, but I love the RAD because it's really useful for us as behavior analysts and speech pathologists and other people who are collecting data in their sessions. I collect data on all of my learning trials. I think it's great dynamic assessment. I also have a lot of colleagues, they do pre-testing and post-testing on their sessions. They do a pre-test at the beginning, they do a post-test at the end, and they teach, teach, teach in the middle. I love that. The RAD lends itself really well if that's your clinical approach, because that is the RAD. Pre, post, what's the difference? Are you seeing gain over time? Ideally, what you also see is that baseline kind of going up over time because they're retaining the skill. That's what we saw struggles with our study was the retention of the skill from day to day. And then you also think from Thursday to Monday. Again, they're 3 and 4 year olds. The retention from Thursday to Monday is relatively low. Okay. BST, again, we did that behavioral skills training. So we've got this protocol. We said, here's what you do, here's how you do it, train to fidelity, and then implement. We didn't, I don't remember off the top of my head, but I don't believe in this study we had any booster sessions. I don't remember us having to do a booster session because this person wasn't implementing. So it shows the BST is really effective, which again, the literature really supports that anyway. Um, but saying, all right, what do we do here? Okay. When we're selecting our targets, we've got to consider the developmental hierarchy. We've got to think word, syllable, sound. You've got to proceed in that order. One of the things that we do often see, though, is work on parallel segments. So, again, I told you I talk a lot with my arms. Okay. Parallel instruction. So, we're working on segmenting at the syllable level. We work on that for a few minutes, and then we try some easier phoneme tasks. So words like at. So I might say if I'm working on blending words, if I'm working on blending, I got to think about how to do this. If I'm thinking about blending words, I'm going to say, okay, cow, boy. What word does that make? Cowboy. Great. We've got a known word. Great. Fantastic. We do that for a bit. Then what I do try to do to kind of push us forward is say, now let's try some that are a little bit harder. At. What word does that make? So notice that I moved from the syllable to the phoneme level, but now I've only got two sounds. And as we're thinking about blending, I'm like, all right, I can provide an easy support here, which is at. There's a vowel. That's my SLP training. I can stretch that out so that it makes it a little bit easier to support that initial acquisition as we're moving into that initial acquisition phase at a harder skill level. Okay. We think about that distal and proximal connection. The more proximal it is, the more we want those letters to be included. The more I do want the kid to see the A, I want the kid to see the T as we're doing it. Okay. Elkonin boxes. Elkonin. Elkonin, very commonly used to do this. Every sound gets a box. You can do it with tiles like blocks or letter manipulatives. You can also write the letters in on a whiteboard. Okay. Very easy way to introduce that phoneme grapheme correspondence in a way that doesn't take a ton of time. I mentioned earlier the consideration that if you are trying to choose letters, okay, well, then how many letters do you introduce at once? There's a lot of literature on that that goes beyond the scope of this talk, but the idea that I'm getting us to try and think about is moving from easy to hard, word to syllable to sound in terms of phonetic complexity, but also thinking about the complexity of the tasks themselves, breaking words down, building them up, holding a word in your memory, taking a sound off, trying to replace it with something else. Again, thinking about those phonetic considerations. And I know it feels like I'm moving through these last few slides a little bit faster, but it's because we've talked about all of this already. I primed us for it. Now I'm just kind of rehashing and summarizing it for us. Insurance companies, hear me say this, optimal intervention windows are group estimates, not individual like prescriptions for individual kids. So as we're thinking about IEPs, as we're thinking about insurance plans and authorizations, we've got to, they're benchmarks, they're guidelines, they're recommendations, they're group level performances, but also um, We got people who are running marathons in like 3 minutes, and that is not a general representation of what 30-year-olds can do. So we've got to think about that variability that we see here and the individual factors that a kid may be bringing. The weaker their phonetic discrimination skills are, the harder it's going to be to make progress on these tasks. The more complex their learning profile in terms of if they have comorbid issues, they have other conditions like cerebral palsy, autism, intellectual disability, any number of other conditions that would impact their learning trajectory in any way, even if that's from a fine motor perspective. Okay, well, that's going to change our trajectory in terms of the actual writing. Um, we might see what we call it slower on ramp. So that's where Erbely and colleagues' recommendation about that extended benefit. Okay, but we also see an initial slower learning trajectory because we're trying to do more in terms of the letter and the sound. We're trying to do all of that. So if we're making slower progress, we want to be intentional with how we're doing that so we don't overwhelm the kid. Thinking about introducing 3 to 4 letters max at once. Really, 2 to 3 would be better. That's where that SLP training comes in handy, where I'm like, all right, how do we maximally contrast these sounds? Let's teach a, and t. T. This one is a continuant. Ah, and it's shaped like a little circle. T is two like hard strokes and it's a t. So it's a hard, like it's a stop. Teach those in parallel because the kid is less likely to get them confused. That's why we don't teach A and O at the same time. That's why we don't teach P and Q at the same time. Those are the considerations that we have to now think about when we're not just thinking about the spoken language intervention. Again, individual intervention is great when kids need it. The research also shows small group instruction is actually also really effective and in some cases more effective when we're also seeing these positive practice opportunities, when we're getting these modeling opportunities, when we're getting positive peer and instructor models. And we're engaged and actively engaged in the process, thinking about how we increase responding in groups. Okay. So if you're thinking about group settings, if you're thinking about small group instruction, right? Individual turns should be used to assess, right? Like, did you do this correctly? That's the data I want to track. When we're using choral responding or group responding, where I do a model and then everybody does it, that's where we're really benefiting from the additional auditory and visual input that we're getting from other peers of, oh, that's what it's supposed to sound like. How do we make it sound like that? Okay. You're getting that additional kind of peer and modeling. Interspersing and interleaving are also really important for us to think about. If you kind of mix your task complexity, your stimulus familiarity, throw some familiar words in there, throw some easier words in there to kind of maintain that responding level. That can be really good for maintaining motivation. That can be really good for maintaining persistence even when tasks are harder. While also then saying, I do often move back and forth clinically. This is what I do clinically. I'll move back and forth between syllable and phoneme level tasks. I will make it clear which one we are doing, but I will go back and forth between them so that this starts to feel a little easier. And as that feels easier and we're not as challenged as now we work on something that's a little harder. As that gets a little bit more frustrating, we go back to the syllable level where it's a little bit safer, but we're still getting that benefit of that practice. Okay. Dose here, it's really important to kind of contextualize. Dose is defined as a practice opportunity in which feedback is also provided. This is the challenge with the computerized systems in terms of as we're looking at AI, as we're looking at um, good job is not feedback. We've got to be specific at it. We've got to be specific. I love the way that you put those sounds together. I love the way that you broke that word down. Ooh, that word was really hard. Now we get at that corrective feedback. Okay. We've got to give them feedback on how to do it better. So I do often try to take as much of an errorless learning approach here as I can. I don't always. You can kind of look at prompt fading a couple of different ways, but I do, it's immediate corrective feedback. If they get it wrong, I'm like, no, here's your model. That's one of the reasons why the Story Champs the manualized intervention there worked so well because we used a two-step prompting procedure, just like they do in their product in that intervention. Okay. They use a two-step prompting procedure to say the point about this is to be effective and efficient. and not to need the specialized training of an SLP or a BCBA to be able to say, oh, which prompt should I use? Here's your two, like, here's what you do. If they get it wrong, here is what you do. We took the same approach on the phonological awareness intervention to say, if they get it wrong, literally model them and have them imitate you back, right? To increase that dose of correct responding opportunities, to maximize, to get as high on the correct number of performances to balance out those lower performances. Okay. That immediate corrective feedback. This is the good news here with phonological and phonemic awareness is you can move back and forth really quickly. You can do this at relatively quicker rates because the skill itself can be done quickly. You slow it down as kids need. Story Champ's prompting procedure again said that really useful for us in designing that phonological awareness intervention we used with those kids. But I wanted to make sure to save time. I mean, it's 15 minutes, feels like a ton of time, but I wanted to make sure that I left time for us to kind of talk about this or talk about anything that's come up for us as I've talked for the last really long time. Wanted to end us with a GIF of Moira Rose here. And all questions are good questions as long as they're connected to the data and what we're talking about. My contact info is also there if you want a copy of any of the studies that I have done that I'm happy to share here, or if you have questions that I can be helpful with moving forward. But slides are gone. It's just me now. What questions, comments, thoughts, concerns, existential crises related to phonemic awareness do we have? Sorry, I also meant to hydrate while I was talking. That's why you've noticed my voice is now a lot more gravelly. Bad SLP in me, I'm sorry. But I got so excited. How can I be helpful? I tell students this is when I panic because no questions either means things went really, really well or things went really, really terribly. I don't love living in either of those spaces because I like that productive space. If
I
you have
think you
questions,
should go with the really, really well.
oh, okay, great.
No, I think this was really informative and like very validating. And like you like identifying like what are the more likely to have more effect items was incredibly beneficial. And just again, like I think the idea that we don't have to do it all, but we can inform the targets, we can inform
Mhm,
the procedures because there isn't enough time for speech pathologists to do everything. So really, I love
mhm,
your common sense, like we're living in a real world kind of thing. And also, like you look at an insurance authorization, because this is an area like when we're talking about learn units or learning opportunities that I keep wanting to us to look at as speech pathologist. It's not the number of minutes of therapy that we get; it's the number of great learning opportunities that kids are receiving all
mhm,
day, every day, whether that's from us or from someone else that is addressing the goal of concern. And so I love your focus on that. I think that's incredible.
mhm,
That's what's going to get insurance looking at us in a different way and saying, oh,
mhm.
not limiting to 26 per year or 35 per year or whatever sessions, regardless of duration. Like that never has made any sense. Anyway, thank you. I appreciate you.
Thank you. And I think that's a really important thing for us to think about is I'm less familiar with it on the ABA side of things in terms of authorizations and plans of care and things. But again, as we're looking at um, time spent in session. It's about what we're doing with it. And again, how we can partner with different people to say, all right, what are we targeting and how are we targeting it? Again, kind of a general expectation in terms of what's a reasonable amount of time for us to be making progress. How do we problem solve? That's what we get paid for, in my opinion. That's what we get paid for is problem solving when the learning, the skill acquisition trajectory doesn't match the literature perfectly. There is a reference I didn't include today because I just, oh my gosh, there's just so much. Schul and Boudreau. Schul and Boudreau, Schuele, and Boudreau, Boudreau, I believe. I think it's 2008. It's a tutorial. It's a really good introduction to this for those of you who are partnering with other people. Schul and Boudreau, I think it's 2008. It's a really good tutorial. I believe it's in language, speech, and hearing services in schools. Um, Really good overview of phonological and phonemic awareness as sort of a primer. 2008 is really kind of when there was a big to be fair, I was a junior in high school, so this is me looking at the literature. Um, Big sort of push to be like, oh, SLPs are doing more in the literacy space. We should be doing more in the literacy space. But that was kind of my understanding of when that started kind of taking off. Really good primer that could be a good reference to share with other professionals as an introduction to kind of, again, the task hierarchy, the progression. Nothing from that paper that I believe has changed substantially in terms of what they presented, other than we know more now than we did in 2008. You'll notice my voice is also getting lower. That's not great. But other things I can do to be helpful, other questions or thoughts or pushback and criticism are also valued, I suppose.
This is just a small one, Dr. Rayfield, but I noticed someone said that they were a little late and asked about access to the slides, which I believe you told us we were welcome to email. Would
Yes.
you be able to pull up your email address again if you don't mind?
Yes, I will put my email in the chat.
Oh, thank you. Even
Um,
better.
and then if y'all are wanting to send them out, you're welcome to. It just means I have to send them to you. So just tell me to get them to you and I will. But literally, I love email. I love emailing people when it's about like improving client care. So if y'all have questions or y'all want a copy of the slides, I'm more than happy to send them to y'all individually or in mass. That's where I'm at. I tell students to get comfortable with the silence, but also I'm sitting here continuously trying to talk to fill the silence. But if you have questions, I'd rather you fill the silence.
I have a question. Um, you had, and I might have missed this, a few times I noticed you talking about syllable level. And I used to include syllable level, like I would start with like, well, not start, but like one of my targets early on would be like dinosaur, or like usually it was like two syllable words to introduce the idea of blending.
Mhm.
Then I started hearing people saying that there's research showing that it is not useful at all to be teaching blending of syllables. Do you know what that could have been referring to? And is
I
that
am
true?
actually really shocked to hear that. If somebody else in the audience knows more about this than me, I'm more than happy to entertain that as well. I have not heard or seen that. Again, because phonological and phonemic awareness are often viewed both conceptually and practically as related sets of skills that operate in parallel. And so it's often talked about in the research and clinical practice to say, like, the work at the phonological level sort of serves as that sort of foundation to do similar work on a harder skill. So I've not ever heard not to do something at the phonological level like segmenting or blending in particular, because those are the two target skills. The
Yeah.
the consideration is typically to not prioritize work there in uh, stead of doing work at the phonemic level.
Okay. And then that makes sense because it's a nice way to introduce to even if it didn't work, I do sometimes use it because of the idea of like introducing what we're trying to do. So good to
Mhm.
hear though that there was not research saying to not do that.
I'm not familiar with literature saying that, and I say that having looked at my meta-analysis today, which is the phonemic level. I looked at again in preparing for this talk, Marian Rice's systematic review and meta-analysis, Shulin Boudreau's original work, Erbely and Colley's work, Aries, and I've not seen anyone in the literature. And if someone has literature that refutes that, I'm more than happy to engage with it. I have just I deeply respect Marianne Rice's work. I don't know Dr. Erbely's first name. I'm just sorry. I deeply respect their work, and I've never seen anything that suggests that.
Thank you.
Yeah. Sorry. When I get shocked by things, I'm also like, I can't fathom it. So, um, if y'all have my email. If you know other literature on that, please send it to me.
I have a question for you. I know that you're teaching in a CSD program, but do you teach any of this to behavior analytic programs at all? I
I
don't know if
don't.
there's a behavior analysis program at Kansas State or no.
So at Kansas State, we do not have one that I'm
Mhm.
aware have. Doesn't mean we don't, but I deeply don't believe that we do. KU does. Trina
Hmm.
Spencer, actually, Dr. Spencer is at KU.
Right.
Love her to death. Deeply respect. Shout out to her and her colleagues. They're all phenomenal. But I don't, but it's also because I've never been asked. I
Hmm.
do teach this to. I often do invited talks and guest lectures for our early childhood education program. So I do teach this to other professionals. My heart is in speech pathology, but my heart is really in reading. So that's where I'm like, the more people I can talk with about this, the more I love it.
We need to get you on the ABA circuit.
Oh my gosh, it makes me sound so fancy. Or like a racehorse. I'm not sure which, but either way. Anything else I can do to be helpful? Are there questions we have? Other things that we want to talk through? Sorry, I'm drinking tea and water at this point to just like dehydrate and rehydrate. So
I have another question. Oh, do you, Heather? Go ahead.
Well, if your question is about phonemic awareness, then it's probably more relevant.
No, I was going to ask about specific explicit reading and curriculums.
Okay. What do you know and what is your experience and expertise in morphological awareness? And this is a completely different talk. But in morphological awareness, its importance, like do you have very similar strategies of identifying what's most important to teach, what sequence we teach that in, those types of things?
you're right that that is a completely different
It's
talk,
a
but it
different
is an
talk.
important one.
Yeah.
So I know Dr. Crystal Alonso does a lot of work with morphological awareness, and I know that in particular because I had a conversation with her about this at the training several years ago, and she was like, "Well, this is the thing that we should be focusing the most on," and I was like, "Well, this is the thing we should be focusing the most on," and she's talking about morphological awareness. I'm talking about they both need to be targeted. So she would be a better reference. There's a lot of people who do work in that space that would be a better reference than me. What I will say is that that morphological awareness does operate, then kind of intertwine with that phonological awareness at that syllable level, because a lot of morphemes are also syllables. As you think about ing, as you think about well, that's un, prefixes, suffixes. A lot of them also serve as syllables. So there's an intersection there. But some of them also operate at the phoneme level as you think about like the past tense ed. It's two letters, but it's often pronounced as a d or a t. So now we're at the phoneme level. So I'm like, gotta do this. Um, there is, as a quick reference for people, um, the Informed SLP has a or an open access article reading, whatever you want to call it, on morphological instruction that includes um, a chart of like when to target morphemes in terms of complexity and developmental acquisition, which is why I'm referencing it here. Again, I'm not getting like a kickback or anything, like I'm not connected with any of these companies or products. I just happen to know that that's an open access thing for them, that it has a like a chart that would be really useful for practitioners in terms of being able to then kind of think about the connection between phonology and phonological awareness and phonemic awareness, and picking targets in terms of salience, the complexity that now we're talking about in this talk in terms of their phonetic complexity, but also their developmental progression. So I don't have a link for that off the top of my head, but I do know that it's the Informed SLP and it's morphological awareness. And surely if we Google that, it would get us to the right place. Even if it's not open access, it's not what I'm talking about. I'm sorry for not having a good reference for that off the top of my head.
It's fine. I can search. It's great. Thank
Perfect.
you.
Does that answer your question though, in terms of like considerations, I guess?
Yeah, no, it does. And like I said, I knew it wasn't what this talk was about, but I was dying to question you about it since I did see it in here. But
Yeah.
it's one of
And
those areas where
it is,
it's not my personal strength.
it's not mine either, which is why I'm like, I know it is Crystal Alonso's.
Yeah.
but also just again in thinking about that intersection now as we're thinking about reading morphological awareness, it's a parallel issue, but it intersects at the phonological and then also the phonemic level, depending on what the morpheme itself is,
Yeah.
what the sound meaning structure. Phonological awareness, we're looking at sounds that carry meaning. Morphological awareness, for those of y'all that aren't like I just kind of jumped onto that. Morphemes, we're talking about the sound, the smallest unit of meaning. So that can be a word, that can be parts of a word. It's now we're in kind of a, you're right. I'm like, there's a part two that someone else is going to need to do.
Another person who's done a lot of work in that area is Ken Appel.
Yes. Thank you so much.
Yeah.
Appel and Masterson, I believe, as
Yes,
well.
yes. They've developed an assessment and lots of intervention guidelines.
Yes. And I'm so sorry. Thank you so much for jumping in on that because again, I get so excited and I blank, especially in areas that aren't my strength. So thank you, for sharing that.
I like your excitement.
Thanks.
We have about 3 more minutes. So my question was, given all the interest in reading science and explicit instruction and all of the Orton Gillingham and direct instruction and so on and so forth, do you have any recommendations as to teaching reading? Like I'm a direct instruction fan,
Hmm.
but others aren't. So I just want to hear your opinion.
Yeah, and that's where that's where I kind of said earlier, I was intrigued that Rice and colleagues actually were like Lexia. Ooh, actually don't quote me on that. I think they plugged Lexia in their article because it's so rare to see research actually say, here is a program, here is an intervention, because then you get into marketing, you get into if I say don't do something with someone, well, now I'm hurting their business. So I don't see that a ton. And I do try to avoid specific program recommendations, but I am seeing a lot of marketing hype training recommendation regarding letters, LETRS. A lot of states are including requirements for teachers to be trained in science of reading, that product, that program in particular. I would like to believe that means that it is effective and evidence-based, but I myself haven't been able to get trained in it, so I can't actually speak to its quality. I would say anything that follows explicit instruction, where you're explicitly teaching what you're wanting kids to do, that's going to be a good quality intervention opportunity for us. So the short answer is I'm actually talking around the answer to your question.
That's okay.
Sorry.
Nope.
If it's explicit, if the dosage is adequate and it's engaging and developmentally appropriate, I'm like, do it.
All right. I think we're right at 5:30, so we'll go ahead and finish up. Huge thank you to you, Dr. Rehfeld, for such a passionate and engaging presentation. I think it always comes alive when our presenters are so excited about what they're sharing. And thanks to our audience members as well who shared thoughtful discussion and questions tonight. For anyone who was seeking CEUs, please don't forget to fill out